People end up in homelessness for myriad reasons. When we were started in 1985, the community specifically had us be a medical program. What we learned as we were doing the medical care in the early days is that virtually everyone who had been in the shelters or on the streets for a long time was also struggling with co-occurring mental health issues, usually severe and persistent mental health issues like schizophrenia and bipolar disease, and or a pretty active and complex substance abuse problem.
Were you when that happened?
23.
Mm-hmm.
So I broke my neck when I was 23, and I got addicted to, that's when I got addicted to opiates. And
Through pain medicine?
yeah, I couldn't get my mental health issues dealt with. My pain management issue, it just wasn't getting dealt with. And you could go up in that window where it drops down and get out of the cold. You could right down in there, there's a little like alcove that you can hide out in and sleep there. That's why I stayed there a couple of times.
When you talk about people who suffer psychiatric disorders, we're not talking about other people. We're talking about all of us. 1 in 5 people will suffer depression in their lifetime, roughly. 1% of the population has schizophrenia, 1 to 3 to 4% have bipolar disorder, anxiety disorders, panic disorder, social anxiety, generalized anxiety, OCD, eating disorders, addiction, so forth. We're not talking about other people, we're talking about ourselves. If we're not talking about ourselves personally, we're talking about loved ones. And in fact, if you live a life where you or a loved one are unaffected, it's sort of like winning the lottery.
My life was just a mess, it was a catastrophe, and there was nowhere for me to go. There's just nowhere to go.
Very sadly, psychiatric illnesses are a part of the very difficult lives that many homeless people lead. In all of the different ways that Boston Healthcare for the Homeless is able to connect with people who need care, having mental health services be increasingly just a consistent, routine part of what is provided is a very, very powerful change. And I think one of the people most responsible for that change, especially in the last 5 or 6 years, is Derri Shtasel.
Derri, first and foremost, is a psychiatrist. What's really cool for Healthcare for the Homeless and for our patients is that she practices with us.
Dr. Shtasel brings not just herself, 2 other residents that join her, and they all see patients simultaneously. So it's a blessing that I can't thank her enough.
She also meets regularly with our chief medical officer and with our director of psychiatry with the idea of pushing us about how we're providing care, what services we should be providing. So it's wonderful to have someone who's so gifted, so experienced in the provision of mental health services to challenge us and to help us evolve our practice.
What she learns from her patients, she then carries with her in the work that she does with psychiatric residents.
Derri completely changed my view of what I could accomplish as a psychiatrist in my career. Derri opened my eyes to a whole new way of helping people, which is to take a step back and really think about systems of care, policy, social determinants of health, and how we as psychiatrists, as clinicians, really are in a position to affect change on a much larger scale.
She was really a magnet, really drawing residents to her to want to learn more about the chronic mentally ill, to work more in the community. She set up some really spectacular rotations for them.
She has embraced the care of this population as something that should be part of what a hospital like Mass General and a medical school like Harvard should be encouraging their students to do. She's really inspiring a new generation of people to look at things differently.
In many ways, Derri embodies hope and leadership in action.
She's now leading an organization that is working with 21 community health centers, really whose mission is to help the underserved get the same kind of medical care that those of us from privileged backgrounds get.
The Craft Center is a great example of one of Derri's most powerful strengths, which is that she can take an idea and turn it into something real that will have an enormous impact.
When you're a primary care provider and you're seeing patients all the time, It's very difficult to think about ways to grow in your career. It's hard to think about how to sustain. Being able to have a day a week that was protected through the craft center, it's a sort of a respite for me personally, and also a way to grow and learn, and also bring my experience from healthcare for the homeless to this broader community. I've been amazed, and actually I'm still trying to get used to the idea that we're launching a program, we're doing research.
And the leadership she's brought to this organization has just been outstanding, and we're so lucky to have her at the helm.
Derri from the very beginning, had just probably more faith in me than I did. It's just been incredibly inspiring to work with her and just to be supported by her along the way.
You've had a set of goals and you've been accomplishing them. And there are a lot of days I'm sure that isn't so.
Like she really has guided me, with like the mental health progress and the direction that it's taken. I do a lot of the work, but they have a lot of the answers, Without them, this doesn't work.